Our patient was an 89-year-old female with a current carcinoma of the cecum and a long history of hypertension, hyperlipidemia, and chronic obstructive pulmonary disease, or COPD. She presented to our vascular lab with a carotid bruit found by her primary physician. We performed a bilateral carotid duplex exam. The duplex exam showed minor calcific plaque bilaterally, but systolic and diastolic velocities, as well as velocity ratios, were within normal limits. Vertebral flow was also antegrade bilaterally. A carotid body tumor was noted on the right side at the internal carotid and external carotid artery bifurcation. The growth measured about 2 centimeters by 2 centimeters, which you can see here, and did not seem to interfere with the vessels or the blood flow of the carotid body, as you can see here, with full color flow in the ICA and the ECA. The growth did not cause the patient any discomfort or further concerns. No carotid body tumor was observed on the left side. Carotid body tumors are rare and unpredictable growths that develop in the carotid body of the neck at the bifurcation of the common carotid artery as it branches into the internal carotid and external carotid arteries. You can see that here as the tumor grows in between the vessels. They are usually slow-growing, highly vascularized, and often found incidentally during diagnostic studies such as carotid duplex exams. Luckily, they are benign in 90 to 95% of cases. 3 main types of etiology for these tumors are genetic mutations, sporadic, or hyperplastic. Hyperplasia is the enlargement of an organ or tissue caused by an abnormal increase in cell production. Hyperplastic forms of carotid body tumors are often seen in patients with COPD or those that live in high altitudes, as both factors lead to chronic hypoxia, an oxygen deficiency that causes adverse effects on the body's tissues. In this case, the patient does not live in an area of high altitude, but has a long history of COPD. Her body's chronic condition of reduced oxygen most likely contributed to a hyperplastic tumor growth in the tissues of her carotid body. Differential diagnoses for carotid body tumors include lymphomas, metastatic tumors, aneurysms of carotid arteries, thyroid lesions, brachial cleft syndromes, and salivary gland tumors. Other diagnostic modalities to further diagnose a carotid body tumor include CT scan with contrast, MRI, and angiography. Treatment options include surgical removal. Due to the current health status of this patient, no other modalities were currently discussed, and her physician will monitor the carotid body tumor for changes. Priority for the patient was the carcinoma of the cecum, for which she had a right hemicolectomy to surgically remove. In terms of treatment, the patient has been put in the care of her gastroenterology physician for the hemicolectomy. She has plans to follow up with her cardiologist and vascular physician after recovery.